Liam Quinn has come to see you in general practice presenting with dyspnea or shortness of breath. How do we think about taking a shortness of breath history from Liam? Now, the list of things that can cause shortness of breath is large, but we can simplify things by using a diagnostic funnel. Using this funnel, we can categorize the causes into four main systems. Firstly, we have our lung causes. These are the 5 Ps: obstructive lung diseases, interstitial lung diseases, and acute respiratory distress syndrome. Secondly, we have our cardiac causes. So we have acute coronary syndrome, we have heart failure, and we have an arrhythmia. Thirdly, we have our blood-related causes. These can be due to a lack of blood or a dysfunction of the blood, such as in a carboxyhemoglobinemia. And finally, acid-base disturbances can also cause shortness of breath. As always, we're thinking, what are the red flags? We can break this down into what's going to kill them now and what's going to kill them later on. Stuff that can kill them in front of you include PE, acute coronary syndrome, pneumothorax, and arrhythmia. The things that can kill them way later include things like lung cancer and tuberculosis. Lastly, psychiatric and neurological causes should always be considered. Let's speak to Liam and hear his story.
Hi Doc, good to finally see you.
Hi Liam, thanks for talking to me today. How can I help you?
I'm mainly concerned about my breathing. I feel short of breath even when I do short trips to the shops now.
Can you describe what you mean by shortness of breath?
I can't really explain it. I just feel quite out of breath.
How bad is this shortness of breath?
The shortness of breath is getting pretty bad. It's making it hard to walk to the park, and that's only 100 meters from my house.
How far can you walk before the shortness of breath comes on?
I don't know, 100 meters? Less?
When did you first notice this shortness of breath?
How long have I felt short of breath? Quite a few years now.
How long has your shortness of breath been getting worse for?
I noticed the shortness of breath getting worse about 6 months ago.
Do you still have the shortness of breath now?
I always have it, but it does get worse sometimes.
Does anything make the shortness of breath go away?
No, nothing has really helped so far.
Does anything in particular trigger the shortness of breath?
I feel short of breath wherever I am.
Thinking about our diagnostic schema and red flags, there is enough information here to rule out some serious differentials. He has a chronic picture of disease. Instantly, we're less concerned with stuff that can kill him right now. Unless we later find out something that points back towards these, I can pretty comfortably rule out PE, acute coronary syndrome, pneumothorax, and arrhythmia as red flags. We're also less interested in all other acute causes of dyspnea. His dyspnea is both exertional and at rest. As of now, the shortness of breath could be cardiac, respiratory, hematological, metabolic. Let's keep going. Do you have a cough?
Oh yeah, I've definitely had a cough.
Are you bringing anything up in the cough?
I have been coughing stuff up.
Are you coughing up any sputum?
Yeah, there is sputum. I'd say I cough up a few tablespoons a day.
What does your sputum look like?
The sputum is pretty clear, but lately it's looked a bit pink.
Is there any blood in your sputum?
It's usually pretty clear. Recently it has been a bit pinkish as well though. There might be blood in it, I think.
When did you first develop a cough?
About 15 years ago.
Has your sleep been affected?
The cough is worse at night sometimes. It can be so bad that it wakes me up.
Have you been feeling fatigued?
Yeah, I have felt quite tired recently. But that's just my age though, right?
Have you had a fever?
No, I haven't had a fever.
Have you had any chest pain?
No, I don't have any pain.
Have you lost weight?
No, I haven't had any strange sensations like that.
Have you noticed any night sweats?
Yes, for the last 6 months or so.
Any loss of appetite?
I guess so, yeah.
Have you been exposed to any dangerous exposure at work?
I'm retired now, but I was a marketing manager.
Have you immigrated from another country?
I've lived in Greece for a few years when I was young.
I've been clustering questions together to quickly screen for the remaining red flag differentials, as well as other possible causes of his chronic dyspnea. Because of this, we now know a fair bit more. Liam is afebrile with a chronic cough that has recently started producing blood. He's experiencing the constitutional symptoms of unintentional weight loss, night sweats, loss of appetite, which is now pointing us to a chronic inflammatory or malignant process. Now, let's ask some questions about his medical, family, and social history to drill down on that diagnosis. Do you have any medical conditions?
I mean, I had asthma as a child, but I haven't had any attacks since I was like 12 or something.
Are you taking any medications?
I don't take any medications for the asthma anymore.
Have you ever had tuberculosis?
I haven't had any respiratory infections.
Do you have a family history of anything?
I don't have a family history of anything.
Has anyone in your family had cancer?
I don't think I have a family history of cancer.
Do you drink alcohol?
I drink 1 to 2 pints of beer every week when I'm hanging out with mates.
Do you smoke?
No, I quit smoking 2 years ago.
How much did you smoke?
I smoked about a pack a day for 40 years before I quit.
Are you retired?
I'm retired.
What did you used to work as?
I'm retired now, but I was a marketing manager.
Did you ever work around carcinogens?
I don't recall being exposed to any carcinogens.
Do you do any exercise?
I don't exercise at the best of times, but the shortness of breath has made exercise impossible.
At this point, we've found out that Liam has no significant medical or family history. However, we know he was a long-time smoker. Now, given Liam's age, the time course of his shortness of breath, bloody sputum and his constitutional symptoms, it is unlikely to be the following conditions. Given his extensive smoking history and the negatives for most other differentials, my top differential is a lung malignancy. That's how to approach a patient with shortness of breath. Try it out yourself. Head to Oscar AI to take a history from our virtual patients and master the approach to shortness of breath.
If you like this video, check out more over here. And if you want to master clinical skills, head to Oscar.